Hello, everyone, and welcome back. Thank you so much for listening to our podcast. We really appreciate it. We're back with Leah, our co-host. And today we're going to be talking about, of course, healthy mouth, healthy body, and periodontal disease.
So over the weekend, I was looking online at dental specialties, and I found out that there's 9 or more different dental specialties. What are they?
Yes, absolutely. Yeah. So there's 9 dental specialties that are recognized by the American Dental Association. Of course, and we can go over them so people have an understanding. Like medicine, there's so many different specialties. Dentistry is the same way, it has increased ever since I graduated, which is, 200 years ago. Anyways, so, the first one and foremost is the dental public health, which they work on preventing and controlling dental gum diseases and also promote dental health through federal and government agencies, basically. And of course, then you have endodontists. Endodontists basically specialize doing root canals. So root canals could be very simple and very complicated. So these guys actually specialize working under a microscope to be able to go inside a tooth and do the root canal treatment for you. Then, of course, you have your oral maxillofacial surgeons, which do more extensive surgical treatments, moving the jaws forward and backward, doing a lot of trauma cases, pretty complicated cases. Of course, they do dental implants as well. You have your radiology, just like a radiologist would in the medicine. There's been so much advancement that we actually have a specialty in that category as well. Then, of course, you have your orthodontists. As you know, they do braces to kind of move teeth and get you function and aesthetics and everything else. Pedodontists, who are specialized in taking care of children in our field. Cosmetic dentistry and implant dentistry is not quite a specialty, but of course, it's not recognized. I would say it's definitely a specialty because it requires a lot of artistry and a lot of knowledge. However, it's not recognized by the American Dental Association, but I could definitely consider it to be a specialty. Prosthodontist is someone who actually specializes doing pretty much full mouth reconstruction. Is very extensive work. And of course, when it comes to our specialty, which is periodontics, and of course, our specialty is for prevention, diagnosis, and treatment of gum disease, and also placing dental implants.
Last time we talked about periodontal disease and we kind of touched up on gingivitis. What is gingivitis?
So gingivitis is probably the mildest form of periodontal disease. It's definitely reversible. And it's, of course, the signs are having bleeding gums, swollen gums, puffy gums. And it's usually because of poor oral hygiene. There's, of course, other factors that actually contribute to having inflammation and gingival inflammation, which we'll go over in the next episodes coming along. But, of course, that's what gingivitis is. It's right before you get to the more significant periodontal diseases.
So you said gingivitis is reversible. How would you reverse it?
So reversing gingivitis, of course, is reversing inflammation. So when you have plaque and bacteria that builds up around your teeth, they produce a lot of toxin that the gums don't like. So it's an irritant. So the body's response is first to get to get puffy. You're going to have some bleeding gums. And what do we need to do is get rid of that plaque and bacteria. So when you have regular cleanings done, and of course, improve your hygiene at home, flossing, cleaning, using mouthwashes, that's how you can basically reverse gingivitis. That's how it's done.
Now, when you say bleeding gums, that sounds really gory and scary. What is that?
So yeah, that's a good question. Inflammation around the gums will cause the gums to become puffy and red, just like when you have a scratch on your hand, basically. So if once you're brushing and flossing or stimulating the gums in any fashion, that's when you will notice the bleeding. So sometimes you could have spontaneous bleeding, basically, but that rarely happens. You have to have pretty severe gingivitis, but it's really upon stimulation of the gums when you actually see it.
So if you don't take care of your gingivitis, the bleeding gums, what would happen next?
That's a very good question. So what happens if we don't take care of the inflammation? So when you have all these plaque and bacteria around your teeth, at some point, of course, this is pretty chronic. It takes a while for it to get to that point. The body basically will show a more aggressive response, which means there's all these toxin, which is the plaque and bacteria and food debris around your teeth, and the gums become inflamed. So now the body's trying to sell all these fighters to the site, try to fight the disease or fight the bacteria, and it can't because it's not being taken care of. So all this fighting happens within the gum tissue. And because of that, the outcome is destroying more structure that supports the tooth, which is the bone. And when you start losing bone around your teeth, that's when we call it periodontal disease in this fashion of called periodontitis, which is inflammation of the supporting structure of our teeth, which is the bone. And of course, with time that continues, it gets worse and worse. You start losing your teeth, losing more bone around your teeth. The teeth will become loose and end up losing your teeth, basically.
So is there different levels to periodontal disease, like 1, 2, 3?
Very good. Yeah. So we do have different levels of disease, as calling mild or moderate to severe. Mm-hmm. Yes, we do. Of course, that nomenclature has changed with throughout the years, but that's how we recognize it. Of course, we have different ways of measuring it, understanding what everybody's disease is about, and of course, based on that, we make determination of what do we need to do to try to treat it.
So it goes from gingivitis to periodontitis?
That is correct.
Okay, and you also mentioned that there's different types of periodontitis. What are they?
Yeah, so periodontitis, the most chronic form of periodontitis, which happens in adults and sometimes happens in youth as well, is a more chronic fashion. It takes a while for it to develop, where you have pockets and disease around the teeth and you start losing bone. But there's different forms of periodontitis as well. One is called the aggressive periodontitis, basically when patients that are actually clinically healthy start losing more bone and, of course, faster. Basically, it's a much rapid way for them to lose their bone around their teeth. And of course, it could be contributed to mostly either genetics or how they respond to the bacteria in their mouth. So, of course, the next is chronic periodontitis, as we discussed, and it's the most frequently occurring type of a periodontal disease. And it's chronic, and it takes a long time for it to develop. Mostly happens in adults. And it can happen rapidly and stop, or it could just be continuous throughout your lifetime. Then, of course, you go into different type of and going back to aggressive periodontitis, you can have it to be generalized or localized. So we used to have a disease called juvenile periodontitis, where it actually affected the teeth that first erupted into your mouth, the front teeth and the first molars. So you notice patients coming in their 20s and they have significant amount of bone loss on those specific teeth, but the rest of the teeth are doing fantastic. So those teeth were affected first. They hadn't built their immune system well. So those are the teeth that erupted in the mouth. So the bacteria, they had a lot of effect from the bacteria in their mouth, and they start breaking down on those specific teeth. But then, of course, after a while, the immune system kicks in. They're able to fight the bacteria in the mouth, and the rest of the teeth are healthy. So those used to be called juvenile periodontitis. Nowadays, we call them just localized aggressive periodontitis. And then, of course, generalized aggressive periodontitis, which normally you see those in patients either have some kind of a systemic issue. We don't see them often, but we do. I've seen them also that they don't have any systemic issues, but it's really generally having severe bone loss at a very young age. Then, of course, you have necrotizing periodontal disease, and necrosis in Latin means death. So it's an infection and death of the tissue supporting the tooth structure, which is the bone, and the PDL, and the gingival tissue, basically. And of course, there's a lot of pain associated with that. You see those mostly. This condition is usually seen in patients that have some systemic issues, they're immunosuppressed, or they have some immune issues, or malnourished, basically.
So we have some patients who take really good care of their teeth. They're good with their oral hygiene, but yet they're still losing their teeth, having gum issues. And then we have patients who don't clean at all, but they have all of their teeth. What are the risk factors?
Very good. So it's not just about the plaque and bacteria around your teeth. And it means if I just clean my teeth, I'm for sure going to keep my teeth. Yes, it's a huge factor. Of course, maintaining your teeth is the most important thing you do. But there's other contributing factors. Age is one of them. The studies have shown that 70% of Americans over the age of 65 will have periodontitis, have basically gum disease. Smoking, tobacco use, one of the most significant risk factors that shows that actually helps in progression of periodontal disease and gum disease. Then, of course, there's genetics. And you see individuals that work so hard and they do whatever they can and they start losing ground, having bone loss around their teeth and even dental issues. And you have some people that don't and nothing really happens. They're unlucky ones. So you're kind of born with good genes that kind of help you protect yourself. Stress is, of course, a very difficult to measure. Some of the studies that are out there are very, very difficult to assess. But stress is a huge contributing factor to many diseases in our body, including gum disease and periodontal disease. Clenching and grinding. So clenching and grinding is a heavy pressure that you put around your teeth. So if you have a tooth that has gum disease and you're putting pressure and grinding, putting heavy pressure on that too, they actually make the gum disease progress faster. So those are another contributing factor. You have certain medications that patients are taking that also contributes, whether it's oral contraceptives. You also have heart medication and some of the blood pressure medications that patients are taking. Some of these, for example, calcium channel blockers actually cause growth of the gum. And when you have growth of the gum around the teeth, actually creates fake pockets, which are areas that plaque and food will basically kind of get in, and you're not able to clean those areas. So that also contributes to having gum disease down the line. Also, poor nutrition. So it's been shown that if you don't have a good diet or a healthy diet, you cannot fight disease as well. And this is an infection, so you won't be able to fight it as well.
So you gave us great information about risk factors. Now, what are some symptoms of gum disease?
So red, swollen, or tender gums, bleeding gums when you floss and brush your teeth, and of course biting to something hard, persistent bad breath, loosening of your teeth, movement of your teeth. If somebody's wearing a partial denture, if it doesn't fit right anymore, or your bite becomes off, those are classic signs of moderate to severe disease. Receding gums. So these are the things you want to watch for. And of course, as you go see your dentist, your family dentist, they'll do more of a comprehensive checkup on you, just to see whether you have gum disease and what the level of that disease is and what are the appropriate treatments. And how do we prevent that? Of course, brush your teeth, floss your teeth, use antimicrobial mouth rinses because they do help. They're not just by themselves good, but you need to use that in conjunction with your brushing and flossing. And of course, understand and be aware of your risk factors. If you're a smoker, if you potentially have diabetes, these are different, as we talked about before. You just need to be aware of that also contributes to potentially you having gum disease or having a more severe type of a disease.
So in our first 3 episodes, we were talking about dental implants and how they can replace teeth. So if I have gum disease, I don't treat it. I can just let my teeth fall out and then get implants later, right?
Right. But that's not the good way to go. So chronic inflammation, as we know throughout many research studies that are coming out, cause a lot of diseases in our body, including cancer. Chronic periodontal disease is the same thing. There's a lot of association, a lot of studies have come out associating the mouth to the body, hence healthy mouth. So healthy mouth dictates into healthy body. So one of the original studies that came out was patients who've had chronic severe periodontal disease and were pregnant actually gave birth to low birth weight babies, or actually gave birth earlier to these babies. So those one of the studies that actually won an award originally. Nowadays there's many studies correlating gum disease or periodontal disease or not a healthy mouth to osteoporosis, respiratory disease, different types of cancer, including prostate, pancreatic cancer, kidney, and even blood cancer, diabetes, rheumatic arthritis, and all that. So there's definitely a big correlation. This is not separate. Our mouth is connected to our body. So if you keep your mouth healthy, you will have a healthy body, basically. And yes, of course, at our next episode, I'm going to be talking to Dr. Nath, who's going to be our guest speaker, talking about inflammation. I'm sorry you're not going to be a part of this. I do apologize, of course. But thank you again. Thank you for listening to us. Thank you for taking the time to listen to our podcast. We really appreciate it.
Bye.
See you next time. Thank you.
Thank you all for listening to the Healthy Mouth podcast. As a reminder, the information we provided in this podcast is for educational and information purposes only, and it is not to substitute medical advice, diagnosis, or treatment. Please check with your family doctor or professional advisor before using any information provided in this podcast.
The Healthy Mouth podcast is co-hosted by Leo Applegate and Dr. Paul Towfighi. Our executive and technical producer is Johnny Flores, and our video producer is Aaron Zaragoza. A new episode is available every other Thursday.